Welcome to the show, everyone. I'm excited about networking with everybody today. We're live on Facebook, so hi to everybody out there. Like us and follow us. We're going to share the show later on. My first guest, I got some newbies here today, so I'm kind of excited about that.
Yeah.
I have with me Dr. Jessica Smith. She is a general mobile dentist providing concierge service. Welcome to the show. I want you to get up on that mic and tell everybody a little bit about yourself and what you do.
Sure. Thanks, Carol, for having me today. So I own a mobile concierge dental service, and I primarily am treating patients in assisted living facilities and memory care units. So I'm bringing dentistry to their doorstep.
That's awesome.
Yeah. So there's no need for them to get out and go to the troubles of doing that.
You know, there's a lot of people out there that they're not mobile. You're mobile, but they're not mobile. I mean, there's a lot of different reasons to go, right?
Yes.
Now, I wanted to ask you, because I asked you before you came on. So, someone's listening to this right now. They got a tooth problem, whatever. Can they just pick up the phone and call you?
Yes.
Okay.
Yes. So ideally, we prefer to try and get them in the preventative stages before that tooth pain starts. So it's really nice when, as soon as they're getting to those assisted living facilities, as soon as they're getting to those memory care units, if they can give us a call, that way we can get in, take some x-rays, and make sure that we're helping them before they start having dental pain.
It's always before.
Yeah.
But a lot of times it's not. So listen, if you are in pain in any way, you don't have to be. Can you tell everybody a little bit about what concierge dentistry, mobile dentistry is?
Yes. So we are there for you. We're not dealing with the limitations of insurance telling us this is what they need, this is how it has to be done. We are actually tailoring it specifically for these elderly patients. I focus on their perhaps their needs, their dry mouth because of multiple medications, their inability to get out and see a dentist, providing that service with dignity and respect, and taking the time to see those patients. I'm not moving from room to room, seeing multiple patients in an hour. I'm getting to know you. It's just me. You're seeing me every time. You're not seeing a different hygienist, a different dentist. You never know who you're going to see. You're seeing me, and I'm going to be taking care of you long term, hopefully.
Mobile concierge service. Her phone number is 602-357-5251. She is valley-wide, and the website is drjessicasmith.com. So dental care, so important, right? It's such a challenge for the seniors. Again, all they have to do, we're looking at people who are seniors who are in assisted living or memory care, you said.
Yes.
Can it be somebody who's at home?
Ever so often, I will treat someone in the comfort of their own home.
Okay.
Ideally, I'm just a little bit more comfortable going to an assisted living facility. That way I can kind of have a better pulse on also making sure that their medical needs. I consult a lot of times with their medical professionals, their doctor, their PA, just to make sure that the things I'm doing is also appropriate for that patient, safe for that patient, and going to take the best care that I can for them.
So what are some of the signs that families should watch out for?
So unfortunately, a lot of patients, elderly patients, they may not say I'm in pain, especially my memory care facility patients.
Makes sense.
They might not even say that they're in pain, but you may notice, oh, they're not eating as much as they used to be eating. And you know what? They're kind of pointing to their mouth, they're holding their face. And I've noticed that recently when I go visit, maybe they're having a foul odor come out of their mouth. All of these things are warning signs that, well, maybe we've kind of dropped the ball. We just haven't been able to get their care, and we need to get on that because there could be a systemic infection now that's going on because of their tooth swelling, fevers, things like that.
You know what I love about my show?
What?
Is that this is great information because people may not even realize that something like this exists.
Mm-hmm.
And that's why I'm so excited because mobile dentistry has been needed for a long time, especially for our seniors living in an assisted living or memory care. Her phone number is 602-357-5251. She is valley-wide. You can check her out on her website. It's drjessicasmith.com, mobile concierge service. Okay, so what would you say makes your practice different than the traditional dental office, considering you're mobile?
Yes. So there's no need for the family members to be at this appointment, right? So oftentimes the family members, they might not even live in Arizona, but their loved one needs to see a dentist. So with our services, I come directly to their door. They give us a call to schedule the appointment, go through some basic health history things, and then it's all taken care of with me. I can come to them anytime that works for their schedule, not with necessarily the power of attorney or the family's time, and take care of them. Again, it's one-on-one, it's with me. I'm not bouncing from room to room. I'm not in a hurry. I can take as long as I need with that patient.
I do want you to make it clear real quickly that this is not about dentures and all those things. This is for what? Tell them.
This is for, preventative things for these patients. I can do different things. Like I also can take care of their denture as well, because a lot of these patients, they may be wearing dentures and they're all of a sudden, they're having sore spots. The dentures aren't fitting like they used to 5-10 years ago, and they actually need a new denture. Or I like to be as non-aggressive as possible and just perhaps reline that denture, try and give that denture the boost it needs to serve that patient the best it can.
So I really like this because a lot of people are probably assuming that this is for emergencies only.
Correct. So of course we can come out and help with an emergency, but really the preventative care. So we can go there before, as soon as they get into that assisted living facility. We understand sometimes there is a few months, a few years in between dental appointments, but if we can get in and start getting them on a nice set schedule, I can get in, take some x-rays, do a full comprehensive exam, which includes a head and neck cancer screening to make sure that we're catching things before they become big. I can also do small fillings. I can take care of their denture. I can do some fluoride, some preventative cavity arresting medication, and take care of these patients before it turns into something really large.
Some of these seniors have not seen a dentist in years.
Yes, unfortunately.
And most of the time it's because either they are afraid, just like everybody else, but also because they're not mobile, because they can't get to them. So she's mobile. She's created this, what she's calling a concierge service. She's valley-wide, and she works with assisted living and memory care right now only. And again, mobile dentistry. Her number is 602-357-5251. It's drjessicasmith.com. Okay, so what would you say to the family who has been putting this off for a long time, like I'm really talking about here?
Yes, and that's the most common situation, and we totally understand that. Don't feel shame. The sooner the better, right? So the longer you're putting it off, the more things can get complicated. And sometimes, unfortunately, they have put it off so long that maybe they do need a tooth extracted. And that might be something that I have a great team of providers in the valley, specialists that I can refer to and I work closely with. So that way I can ensure that patient, say they do need an extraction, say they need a root canal, something like that, I can make sure that they are seen and coordinated with someone who can also help and understand the limitations that the elderly face.
But what's really nice is that if you got an issue, or if you would really like to see a dentist, you haven't seen one in a long time, you're not able to get out, what a great opportunity for you to be able to have somebody come to you. And the other thing is let's say you're doing good, but to keep that up, because you never know when it's going to flare up.
Yes.
Right?
Yes.
Or finding something beforehand when you get in there, how many times that happens.
Oh, exactly. And we find that in the elderly patients, a lot of times we need to see them a little bit more than the 6-month mark because they're eating more sugary substances and things like that.
They do what they want to do.
Right. I don't blame them.
Exactly. But seeing them also more in between is so important as well.
Get some more fluoride on there. Take care of them.
Again, and when you take the x-rays and you can see everything that's going on.
Immediately. All digital.
All digital as well? Really nice. Again, I don't know how many people are around like you, but I know it's really nice that you're offering this, and it's a great service, especially to our seniors. If you're in assisted living or memory care, you're listening, maybe you know somebody, maybe it's your parent or whatever, get them to know this. This is a great service. 602-357-5251. She's valley-wide. Check her out. drjessicasmith.com. I don't have time.